Which type of structure it is? It is bony structure or soft structure? Palate, first of all. And it is present where? In the head and neck. It is a shell. I will say it is a self-like structure. It is bony. All the parts are bony? No. It has got the bony component and the muscular component also. Or the soft component, you can say. Bony as well as the soft component of the palate. So, where is the palate situated? This self-like structure, this palate, it is situated in between the oral cavity and the nasal cavity. Look here. This is the oral cavity here and this is the nasal cavity. And the intervening structure in between these two cavities, it is the palate here. The part that you can see here, this is what? This is the hard palate, the bony part, the bony component of the palate. And that behind that, this posterior border, there is the attachment of the soft part of the palate component, that is known as the soft palate. So, the palate, if you are asked only palate, then you have to describe both the palates, the hard palate and the soft palate individually. So, first we will discuss this bony part of the palate, that is the hard palate here. Okay. So, you see, which type of structure? Where it is present? This is what? This is a triangular shaped structure here. This hard palate and anteriorly, what is this? Anterolateral. This is the anterior, this is the lateral aspect. What is this? This is the alveolar margin of which bone? Maxilla. The two halves of the maxilla fuses in the midline and forms this alveolar margin. So this is the hard palate, and the component of the hard palate, it is not contributed by the maxilla alone. That should be clear in the mind. Many people answer it is formed by the fusion of the palatine process of the maxilla. Of course, it is the major part of the hard palate. It is formed by the palatine, a shelf-like projection which comes out from the maxilla and fuse in the midline and forms the hard palate. But the whole of the hard palate, it is not like it is in the embryology classes, the development of face. You have studied all these things here. So the development of face itself has been formed from 5 processes. Clear? What are the component of the process? What are the name of the process here? Which forms the face? What are the 5?
Frontonasal.
Yes, frontonasal. First is the frontonasal process. The second is the maxillary process, and the third is the mandibular process. Very good. So, here we are restricted to the development of palate. So, these two processes, the frontonasal process and the maxillary process, are concerned with the development of palate, not the mandibular process. Okay? So hard palate, it is forming the roof of the oral cavity and the floor of the nasal cavity. The same shell, look here, the same shell, it will serve the purpose of floor of the nasal cavity as well as the roof of the nasal oral cavity. So what are the components? So these are the incisor teeth here, incisors. Okay, how many incisors? 4. So this component of the alveolar margin in the maxilla, it is developed from which part? Which part? Embryologically, the alveolar margin of the maxilla, which is lodging the 4 incisors above, that process, that part of the maxilla, it is formed by which component? Frontonasal process. That is the frontonasal process. Okay. So there are so many other different nomenclature related with the frontonasal process. One of the component is the globular process. Globular process. It is often asked in the Viva and the MCQ. The globular process of the medial process. Medial nasal process. This forms a component which is known as the premaxilla. So that should be clear in the mind. What do you mean by premaxilla and maxilla proper? There are two terms here. One is premaxilla. Look here. Premaxilla and the maxilla proper. Okay. So what is this? Premaxilla, or you can say primitive maxilla, or the primary maxilla, and this is known as the secondary maxilla. This is the primitive. So the premaxilla, it is that part of the hard palate which develops from the globular process of the medial nasal process, that is the part of the frontonasal process, from above downwards in the midline. Look here, and it lodges what? It lodges only the incisors of the upper margin, upper alveolar margin. Okay. Now the rest of the hard palate, it is formed by what? Antero-posteriorly. Look here. Antero-posteriorly. So if you will see, if it is the whole of the hard palate, okay, whole of the hard palate, then it is completed by the three process, the whole of the hard palate. This Y-shaped area, anteriorly, this Y-shaped area anteriorly, it is the premaxilla or the primitive maxilla. Okay, and this is the secondary maxilla. So, or you can, this is the primitive palate, premaxilla, and this is the secondary. So, these part, antero-posteriorly, if you will divide it into the anterior 3/4 or posterior 1/4. In some book it is written anterior 2/3 and the posterior 1/3. So, whatever you like, it is anterior 2/3 or the posterior 1/3, or you can say anterior 3/4 or the posterior 1/4. Then what is this? Anterior 2/3 and the anterior 3/4. These are the components of the bony components which are forming the hard palate anteriorly. Isn't it? So this 3/4 component, this is the anterior and this is the posterior aspect. Okay. So this anterior 3/4, other than this premaxilla or the which will form the palate here, premaxilla Y-shaped structure, rest of the part, the bony shelf here, look here, this, the incisors, the 4 incisors here, and posteriorly you see there is a Y-shaped margin here, Y-shaped, and posteriorly there is a vertical line here, suture, which is formed by the fusion of the palatine process of this maxilla and posteriorly by the horizontal plate of the palatine bone. What is this? Posteriorly, this is the horizontal plate of the palatine bone. So if you are knowing there is a palatine bone in the head neck, you know that there is a one bone which name is palatine bone. So there must be relation with the formation of the palate of the bone itself. So where it is present and how it is forming the hard palate. So look here. So this 3/4 of the horizontal cell, it is formed by when there is development of maxilla from the body of the maxilla. What happens? There is self-like bony cell-like process starts and fuses in the midline antero-posteriorly, and this and in the form of a suture. This fusion it is in the midline in the form of a suture, and this suture will be known as what? Intermaxillary suture. Intermaxillary suture. Okay, because this component it is contributed by the maxilla. Okay, now come to the posterior 1/4 or you can say the posterior 1/3, whatever. This part of the palate, the hard palate, it is formed by which bone? I have said here there is a bone which name is palatine bone. So palatine bone has got L-shaped bone, which has got the horizontal and the vertical limb. Okay, so this horizontal plate of the palatine bone, this one, look here, this horizontal plate of the palatine bone will form the posterior 1/4 of the hard palate. That means this will be the line of fusion between the maxilla and the palatine bone. This is maxilla and this is palatine. So what will be the name of this suture? Palato-maxillary suture. This suture will be known as palato-maxillary suture. Palato-maxillary suture. Okay. Here in the plus form, you will see on the hard palate, you see there is the line of suture or the articulation of the bones. It is indicated in the plus form here. So this is one limb, this is another limb of plus, this is another limb, and this is another limb. So this limb of this symbol will be known as interpalatine suture, because this suture it is formed by the horizontal plate of the palatine bone. So this will be known as the interpalatine suture. Interpalatine suture. Okay. This is the intermaxillary suture and this is the palato-maxillary suture. Okay. And this suture, this Y shape, what does it indicate? The horizontal shelf of the maxilla anteriorly, it will fuse with the premaxilla, because this part was known as the maxilla because the horizontal shelf was arising from the maxilla itself. But what about the anterior Y-shaped area left behind? That is formed by the individual component, that is the frontonasal process. Okay, so and this will be in the line of fusion or the articulation of this component with the maxilla proper. That means if this premaxilla, it will not unite with the maxilla proper, then what it will happen? I am asking, this Y-shaped area which lodges what? Only the incisor teeth in the upper jaw or the maxilla. If this proper structure, which is known as primitive maxilla or you can say the premaxilla, it doesn't get fused with the maxilla proper here or the bony shelf of which is palatine process, what it will lead to? It will lead to what? There will be a cleft. Suppose it remains like this. Look here. Whole of this structure it is like this. That means there is no articulation in between this maxilla proper, primitive maxilla and the maxilla proper. Then what it will lead to? It will lead to the cleft palate. That means there is an opening. There is a gap in between these two structures because it has to form a single structure which will be known as hard palate from anterior to posterior. Primitive maxilla, maxilla proper and the palatine bone. Okay, so if it is not articulating here with the maxilla, then it will lead to the cleft palate. That is clear? Yes or no? This fusion, it should be on either side, both the side. That means the canine and the lateral incisors. This line of fusion extends from the junction of the lateral incisors and the canine towards the midline, both the sides. So it will be in the form of a Y letter. Okay, so this is the primitive. You have to draw a diagram when you are asked on short notes or the full question on the palate. So if you are asked short notes on the palate, then you have to also draw this diagram for the hard palate and the other diagram for the soft palate. So now this hard palate, this is the bony component. Here it is formed. This bone in the human being, it is like bony component or it will be covered by some structure. If you eat something, suppose it is coming in direct with the हार्ड पैलेट हार्ड है तो फिर वो बोनी रहेगा, और वेदर इट इज कवर्ड बाय सम स्ट्रक्चर्स अबव एंड बिलो, म्यूकोसा से, वेरी गुड, इट इज कवर्ड बाय द म्यूकोजल लाइनिंग. This is the structure of the hard palate. Now what are the layers? What are the other structures which are wrapping this hard palate? I have said this cell. This cell has got two surfaces. One surface is towards the nasal cavity, because this is forming the what? Floor of the nasal cavity and the roof of the oral cavity. So here this surface and here this surface. Both these surfaces of the hard palate will be lined by what? Mucosal lining. So what will be the mucosa lining epithelium of this mucosal lining of the hard palate towards the nasal cavity or towards the oral cavity?
The nasal side में pseudo-stratified columnar epithelium होगा.
Yes. Pseudo, because this question is asked in the Viva and MCQ, that's why I am asking, giving stress on this part. Superior surface, the floor of the nasal cavity, the part of the hard palate, the lining epithelium will be lamba wala, sabse longest name. The lining is pseudo stratified ciliated columnar epithelium. Okay. Now towards the oral cavity, that means the inferior surface of the mucosal lining.
The non-keratinized stratified squamous epithelium.
It is yes or no? Keratinized or non-keratinized? There is a confusion.
No, it's keratinized.
Tell me, it is keratinized or non-keratinized?
Non-keratinized.
It should be what? Don't think, don't answer keratinized है या non-keratinized. What should be the lining epithelium of the oral cavity in human beings? We are discussing the palate of the human beings, not the lower mammals. Get the point? What I mean to say? In the human beings, what will be the lining epithelium here? It is the keratinized or non-keratinized. You will see also, and I will also see. I think it should be the non-keratinized squamous epithelium, because in lower mammals, just like rabbits and all this, the lining epithelium, the mucosal lining, it is the keratinized there, because they eat what? Grasses, rough structures. Okay, there. So it's the skin, the keratinized in dead cells are there. So here there is no dead cells. So it should be lined by the non-keratinized stratified squamous epithelium, which is continued with the inferior surface of the soft palate posteriorly. Okay. Now what are the other structures which are present here? Suppose this the mucus covering is there on this. This is the oral surface. Suppose this surface which I have drawn here, this is the oral, towards the oral cavity. Then this is all lined by the mucosa. Suppose this palate, it helps in what? Speech, deglutition. Okay. So the palate helps in so many things. So when you will eat, the food bolus, when the food bolus travels inside the oral cavity, and if there is no anchoring of this mucosa to the underlying bone, then it will shift or it will be teared. So is there any arrangement of fixing this mucosa to the underlying bone? Yes, there is an arrangement. So look here. So this is the hard palate. So mucosa covering here, that will be fixed over by the sharp fibers strand, fibrous bands, which is known as the fibers of Sharpies, isn't it? So that when the food bolus gets inside, it doesn't tear or shift the mucosal lining over the hard palate. Then what are the other structures? Posterior nasal spine. What are the important parts there? Posterior nasal spine. That means there will be the presence of anterior nasal spine also. Look here. The nasal cavity. This is the nasal cavity, all of you see. There is a spinous process here in the midline. Anteriorly, anatomically, this is the anterior and here it is the posterior one. So anteriorly in the midline, it is the anterior nasal spine. And how this anterior nasal spine it is formed? I am asking. Anterior nasal spine it is formed by which bone? It is formed by the fusion of two bones in the midline. Look here. It is formed by the fusion of the two bones in the midline. Okay? How it is formed? Which two bones?
Maxilla.
Maxilla. So, maxilla fuses in midline, and in the midline anteriorly there is a spike-like process which is known as what? Anterior nasal spine. And this fusion, it is elevated towards the cranial end, or you can say the cephalic end. Why? Because here, suppose this is the maxilla, palatine process of the maxilla fuses in the midline towards the nasal cavity is elevated. Why? So there is a furrow, a gap anterior-posteriorly on which the inferior border of vomer can fit over here from the nasal septum. Okay. So, and because there is no elevation here on the inferior surface, you can see it is smooth. But here in the midline towards the nasal cavity, it is elevated, this fusion, and here it is not elevated. So anterior nasal spine, it was the product of the fusion of maxilla, two halves of the maxilla. But what about this posterior nasal spine? This posterior nasal spine, this part, appointed posterior nasal spine. What it is? Look, this part. This bony part here in the midline, just opposite to the anterior nasal spine, it is formed by which bone here? You can see premaxilla, maxilla, and the which bone is here? That is the palatine bone. Yes or no? This is the palatine bone. So posterior nasal spine, it is not by the maxilla. That should be clear. It is due to the fusion of the palatine bone. Posteriorly it is. Just spine-like process, it is formed posteriorly, and it is due to the part of the palatine bone. This is the what? Posterior border, posterior margin of the hard palate. Okay. So posterior margin of the hard palate, it will give attachment to which structure now? Because our topic is palate. It will cover both the parts, hard palate as well as the soft palate. So what is the area? What is the point where the soft palate is attached to the hard palate to form a common structure which is known as palate? So this is the posterior border of the palatine bone, horizontal limb of the palatine bone, which will give attachment to the soft palate posteriorly. This is the area. This will give attachment to the posteriorly the one, that is the soft palate. Okay. We will discuss this soft palate in the posterior margin of the palatine. In this, another important structure is where you will get the palatine crest. Palatine crest. Look here. Just anterior to the posterior border of this hard palate, here. Just anterior to this, there is horizontal crest-like structure which are known as the palatine crest. These are which is very closely related to the posterior border of this palate, which is known as the palatine crest. Okay. Now, anteriorly. Now, just behind the incisors, in the fused palate, a very important structure you will see here, a foramen, a fossa line, just behind the incisors. This is very important aspect, this incisive fossa, which is asked in the MCQ and the Viva. Look here, just behind the incisors in the midline here, there is a fossa which leads into a foramen, two foramens, which is known as incisive fossa which leads into the incisive canal through which it communicates with the nasal cavity, isn't it? Because just below the nose, look here, there should be some vessels and nerves that communicates with the nasal cavity and the oral cavity. So there is a foramen here, incisive fossa. In the floor of this incisive fossa there are two canals, incisive canals, right and left, which communicates with the nasal cavity, and through this the greater palatine nerves, sphenopalatine vessel, these nerves and vessels passes from the nasal cavity to the oral cavity and from the oral cavity to the nasal cavity. Okay, so this is the communication. This is the incisive fossa. What it is? Incisive fossa. Because it lies just behind the incisor, so this fossa it is known as incisive fossa, and in the floor of this incisive fossa there are two incisive canals. There are two in number. The two incisive canals which communicates with the right and left nasal cavity. Through this the nasopalatine. The name, look here, the name of the nerve itself is what it is? Nasopalatine nerve. That means the same nerve have to cross the nasal cavity also and the palate also. Clear? So nasopalatine nerves, there are two nasopalatine nerves, right and left, and that communicates the either side of the nasal cavity. Now, what are the other structure which are present in the hard palate, which is important structure here? The hard palate anterolateral border, it is continuation with the alveolar arch. Okay. Posterior border, it is giving attachment to the soft palate. Now, there are nomenclature greater and lesser palatine foramen. What are the nomenclature? Greater and the lesser palatine foramen. Suppose this is the base of the skull and you are asked, show me where the greater palatine foramen is present and the lesser palatine. So, greater palatine foramen, it is present junction here, anterolateral aspect. On the, this is the anterolateral margin of what? This hard palate. Just posteriorly, just opposite to this third molar, there is a largest foramen here. This is known as the greater palatine foramen. What it is known as? Greater palatine foramen. On the, or just posterior to that, on this palatine bone, there are small, 2 or 3 small foramens present here. On this pyramidal process of the, this is the pyramidal process of the palatine bone, on which there are, here the foramen which is present, here either side of, it is the greater palatine foramen. Here on the pyramidal process of the palatine bone, 2 to 3 foramens, small foramens. That's why it is known as the lesser palatine foramen here. Here it is the lesser palatine foramen. Lesser palatine foramen. Here it is the greater palatine foramen. On this margin, these foramens are present. Not here, not here in the midline. It is present at the junction of the anterolateral border, lateral border of this hard palate with its alveolar margin posteriorly, posterolateral aspect. So, greater palatine foramen and the lesser palatine foramen, it transmits the structures, nerve and vessel of its own name. Greater palatine nerve, it will transmit what? Greater palatine nerves and vessels. Lesser palatine nerve transmits what? Lesser palatine nerves and vessels. Isn't it? Greater and the lesser palatine nerves. Greater as well as the latter. Greater and the lesser palatine nerves are coming from where? Anyone? Greater palatine nerve and the lesser palatine nerve, from where these nerves are coming to supply the hard palate? Any
Branch
idea?
of the pterygopalatine ganglion.
Yes, very good. That is the largest parasympathetic ganglia. You must have read that is the pterygopalatine ganglia. Pterygopalatine ganglia. So it has got so many branches. When you will read in detail about this pterygopalatine ganglia, so there are so many branches, nasal branches, orbital branches, pharyngeal branches, palate branches, palatine branches. So in this palatine branches, that means the secretomotor fibers or the nerve fibers, because in this palate there are glands also. There are presence of glands. Okay, palatine glands are there. So for the secretomotor fibers coming from this palatine branches in the form of the greater and the lesser palatine nerves, and we have discussed in the previous lecture about the tonsil, lesser palatine, a branch of the pterygopalatine ganglia, that is the palatine branch, specially supply the soft palate and the tonsil, that is the lesser palatine nerve. That's why you look here, just behind this posterior border there is attachment of this soft palate. So lesser palatine foramen through this lesser palatine nerves come, and that will supply the soft palate, and also the tonsil, because we have discussed in the previous lecture, from the soft palate, from the mucosal fold layer of the soft palate, two mucosal folds in vertical form, anterior, one is anterior and the another one is posterior, and creates a tonsillar sinus where the tonsil is situated, which is known as the tonsillar sinus, okay, or the tonsillar fossa. So after supplying this soft palate, it also supplies the tonsil, that is the lesser palatine nerve. It is a very important aspect to mark it for the Viva and the MCQ, the nerve supply of the tonsil and the soft palate. Okay, so and this greater palatine vessels, it will, the root it is like this, here it will supply here, and from here it will go to also to supply the floor of the nasal cavity, greater palatine nerves. Vessels, the greater palatine, it is a branch of which artery? Greater palatine.
Maxillary artery.
Which part?
Third part.
How many parts of maxillary artery? First part, second part, third part.
3 parts.
Yes, third part of the maxillary artery, that is the greater palatine artery. So the palate. Now what would be the lymphatic drainage, or before that come to the venous drainage, where it will drain? We have in the tonsil, we have read there is the paratonsillar vein, then there is pharyngeal venous plexus. So of course the palate, there is the pterygoid venous plexus. One very important venous plexus lies here, that is the pterygoid venous plexus. So what is the pterygoid? What is this nomenclature pterygoid? Pterygoid, it is the plate of the sphenoid bone. Look here, in the next class, when we will discuss the soft palate, go and read today. Here, look here, here is the two vertical plates, which is known as the pterygoid plate, medial and the lateral pterygoid plate. This area there is a pterygoid venous plexus, on which there is the venous drainage of this hard palate as well as the retropharyngeal venous plexus, or sorry, pharyngeal venous plexus. So these venous plexus are two important for the both hard palate and the soft palate. Now lymphatic drainage, where it will go? Tell me. Retropharyngeal. Retro means behind the pharynx. Retropharyngeal group of lymph nodes, and ultimately it will drain into the upper deep cervical lymph nodes. So it is like that. So hard palate, it is important with its applied aspect. How? So you have to think about the formation, how it is formed, what are the components of the bony components which are forming the palate as a whole, and if there is any congenital anomaly during the fusion of these processes, what it will lead to. That's why it becomes a very important part for the short notes. You will, if you are asked the short notes on the cleft palate or the cleft lip, so you have to describe all these things, Y-shaped suture line of the premaxilla with the maxilla proper. What happens in the, you have seen any cow? हमें हर समय जुगाली करते रहते हैं. The premaxilla in those mammals, it is a separate bone. It doesn't also fuses with the maxilla behind, maxilla proper. So it remains a separate bone for the more stretchability. हमेशा बोलस को ये करते रहता है. देखा ना, गाय को, भैंस को ऐसे ऐसे. तो प्रीमैक्सिला इट डजंट फ्यूज विद द मैक्सिला प्रॉपर. इट्स सेपरेटेड इन द mammals. There it is a separate bone in those mammals. So